If you're over 60, what I'm about to reveal will shock you. After interviewing hundreds of healthcare workers and former physicians, I've uncovered disturbing truths about how doctors really see seniors, and how these hidden biases can quietly rob you of proper care, respect, and even years of life. One retired doctor told me, this is the healthcare industry's worst kept secret. And if you don't know how to protect yourself, you could be falling victim to it at every single medical visit. Today, I'm exposing the 5 ugly realities of medical ageism, the hidden discrimination doctors use against older adults. These truths are uncomfortable, but knowing them is the first step to fighting back. And here's the good news. I'll also reveal the exact strategy successful seniors use to flip these biases and demand premium health care. If you ever felt dismissed, rushed, or ignored by doctors, this video will give you tools to make sure that never happens again. Hit the like button if you're ready for the truth. Subscribe with notifications on, because this information could literally save your life. Now, let's begin. 1. Doctors label you expensive and complicated before you even speak. The moment you step into a medical office, your age is silently working against you. Doctors are trained to think in terms of efficiency and cost. The second they see 65 or 70 plus on your chart, many unconsciously classify you as high maintenance, resource heavy, and less efficient to treat. This isn't always malicious. It's systematic programming in modern medicine. Medical schools teach efficiency protocols that condition doctors to see seniors as time-consuming patients who require longer appointments, more medications, and more tests. Former ER physician Dr. Sarah Henderson explained, doctors are taught to pre-categorize older patients before even examining them. And here's where money makes it worse. With insurance reimbursements shrinking and patient quotas rising, doctors are under intense financial pressure. Treating seniors often means more paperwork, more follow-ups, and lower profit margins. This creates resentment that bleeds into your care. Chart-increasing studies prove it. Doctors spend 23% less time listening to patients over 65 compared to younger patients with the same symptoms. Example: 74-year-old Maxine, a retired librarian, came in with weeks of tract chest pain and fatigue. Before she finished describing her symptoms, her doctor cut her off. Let's focus on the main concern today. Her chest pain was dismissed as anxiety. 6 months later, she was finally diagnosed with heart disease, damage that could have been prevented. This is called complexity aversion, where doctors avoid digging deeper into senior symptoms because it might reveal multiple interconnected issues. Instead of tailoring care, they stick to quick, standard senior protocols. Your defense strategy: start every visit with measurable health goals. Instead of, I feel tired, say, my energy has dropped 40% in 3 months. I want to identify the cause. Bring a 1-page health summary showing past progress to position yourself as a proactive partner, not a burden. Negotiate time. Doctor, if today's visit is too short, can we schedule a longer 30-minute appointment next week to address my cardiovascular concerns? Take visible notes. This changes how seriously doctors treat your concerns. 2. Polite medical gaslighting dismisses your symptoms as normal aging. This is one of the most dangerous forms of discrimination. Doctors often brush off real medical problems by saying, that's normal for your age. Dr. Michael Torres, a geriatrician, calls this medical gaslighting. You're just getting older has become a medical excuse, not a diagnosis. The consequences are terrifying. The American Geriatric Society found 85% of serious senior conditions are initially dismissed as aging before being properly diagnosed. Heart disease, normal fatigue, thyroid disorders, slowing down with age, depression, adjusting to retirement, cancer, wear and tear. Example: Carl, 67, complained of worsening stiffness for 8 months. His doctor kept saying, you're not 30 anymore. Finally, blood tests revealed severe rheumatoid arthritis, damage that could have been slowed if diagnosed earlier. Your defense strategy: challenge dismissals. Ask, What percentage of people my age experience this exact symptom? What studies support this assumption? Build a symptom timeline to show sudden changes, e.g., until March, I never needed naps. Now I do daily. Ask, if I were 45 with these symptoms, what test would you order? This forces them to confront their bias. Bring an advocate. Doctors are less dismissive when another person is present to document. 3. They assume you're mentally declining and can't handle complex care. Many doctors secretly believe seniors won't understand complex medical information or follow advanced treatment plans. So, they oversimplify care, often leaving out cutting-edge options. Dr. Amanda Richardson, a neuropsychologist, says doctors consistently underestimate cognitive ability in older patients. Example, Louise, 71, a retired chemistry professor, was diagnosed with early-stage breast cancer. Her oncologist immediately suggested a mastectomy, without mentioning reconstruction, targeted therapy, or clinical trials. His reasoning? At your age, we want to keep things simple. Louise had to fight for months just to learn about her full options. Light bulb your defense strategy. Establish credibility. I managed complex projects for 30 years. Please explain all details. Request technical explanations. Can you explain the pathophysiology and treatment mechanisms? Bring research or prepared notes to show engagement. Ask directly, what would you recommend if I were 40 with the same condition? Use health apps and digital tools in front of them, proving you can handle modern care. 4. Medications are used for control, not treatment. Here's one of the ugliest truths. Many seniors are prescribed psychiatric drugs, sedatives, or mood stabilizers not for medical necessity, but to make them easier to manage. Dr. James Martinez, a former nursing home medical director, admitted, I saw medications prescribed to calm down patients, not to heal them. Bar chart shocking stat. Over 40% of seniors are on psychiatric meds, but only 12% have a diagnosed mental health condition. Example, Beverly, 69, frustrated with slow rehab after hip surgery, asked too many questions. Staff labeled her difficult and gave her anxiety meds. Side effects caused confusion and a fall that broke her wrist. Delaying recovery by 4 months. Your defense strategy. Ask, what exact condition is this drug treating? What's the measurable goal? When will we stop it? Research every prescription independently. Demand treatment goals and timelines to prevent open-ended drug use. Request periodic medication. Reviews with independent pharmacists. Document baseline health before psychiatric meds, so you can prove side effects aren't just aging. 5. Doctors quietly calculate your life's economic value. Perhaps the most heartbreaking truth. Seniors often receive less aggressive treatment, not because of risk, but because of age-based economic formulas. Doctors are trained to use quality-adjusted life years, QALYs, a formula that literally values a 70-year-old's life years less than a 40-year-old's. This influences everything from organ transplant eligibility to cancer treatment recommendations. Example, Walter, 68, with kidney failure, was steered toward palliative care instead of dialysis. The reasoning? At your age, dialysis may not be worthwhile. He fought back, got the treatment, and lived 7 more active years. Your defense strategy. Always ask, would you recommend this if I were 45? If not, explain why, based on medical risk, not economics. Research treatment outcomes in your age group. Many seniors respond just as well as younger patients. Seek second opinions from geriatric specialists. Document and challenge age-based denials. Age discrimination in medicine is illegal. Connect with senior advocacy organizations to help fight insurance appeals. Final thoughts. Now you know the 5 brutal truths about medical ageism. Doctors label you complicated before you speak. They dismiss real symptoms as just aging. They assume cognitive decline and simplify your care. They prescribe drugs for control, not treatment. They calculate your life's worth in dollars, not dignity. but knowledge is power. Seniors like Maxine, Carl, Louise, Beverly, and Walter prove that fighting back works. When you demand equal care, question dismissals, and insist on evidence, not assumptions, you don't just protect yourself. You change the system for every senior who comes after you. Your life has equal value, no matter your age. Don't let anyone, doctor, nurse, or insurance company, decide otherwise. Smash the like button if this opened your eyes. Comment below. Have you experienced medical ageism? What will you do differently at your next appointment? Share this with every senior you know, because this could save their life too. And don't forget, subscribe right now, because together we're rewriting the future of healthcare for seniors and for all generations to come.